We had a long list of nominations. We had 30 to consider. And I understand the list was even longer, but they decided they couldn't have so many nominations, so they shortened it to 30. And it was not an easy decision. It was a difficult decision. But I think the committee, there were nominations dealing with all sorts of medical problems, with depression, with Alzheimer's, with blindness and deafness, and the list goes on and on and on. But I think the committee really began to focus on cancer. For the last 30 or 40 years, the major cause of mortality in the Western countries has been cardiovascular disease. And now that's beginning to change. We have made a lot of progress with cardiovascular disease, with medics, with antiarrhythmics, with intensive care units. Patients are surviving better now with heart attacks and problems. And they're developing chronic disease with heart failure. So that'll be another problem to treat. We don't have good therapy for heart failure. If it's really bad, we have to do transplantation. So what is growing now in medicine is the frequency of cancer. And cancer will probably begin to exceed cardiovascular disease in terms of mortality in Western countries. So we began to focus on some of the cancer associations. And we decided that this association made a lot of sense because it's a national organization throughout Spain, not just a local, but interested in cancer throughout Spain. And it's very broad. It considers social issues dealing with families and patients, but it also is interested in research and supporting research. And after several rounds of discussion and voting, we kept narrowing the list and finally settled on this organization, which is the Spanish Organization for Cancer. And it was a close decision. There were other organizations that were close, but this was really the highest score.